Do you see a lot of patients with bone cancer coming through your office?
Fortunately not. I've seen a few cases, but bone cancer, unless it's metastasized from another form of cancer, is actually fairly uncommon in the family practice setting.
How could you tell it was bone cancer, and how did you diagnose it?
Well, what happened was it was about a 45-year-old female. She came into my office. It was in the afternoon, and she was suffering leg pain down the back of her right leg. And she had recently gone on a trip to Florida, and she actually took the bus. So when she came in, my biggest concern at the time was that she may have had a blood clot in her leg, which is fairly common in people who sit for long periods of time. And sometimes if they're on other medications, they can become more prone to blood clots. So our biggest concern was that she had a clot, because sometimes when you have a blood clot in the deep veins of your legs, it can become unstable and it can actually go to your lungs and cause death from what we call it as a pulmonary embolism. So anyways, we had her go for an ultrasound of her leg, and we found that there was no clot. So the next day she came in, and initially we were treating it as disc herniation in her lumbar spine, because her symptoms were pretty much the same as if somebody has a nerve compression in their leg, originating in her back. So I ended up getting an MRI of her back, and what it showed was a large mass. It was probably about 8 centimeters, and it was pushing on her L5 nerve root, which is basically the 5th nerve that comes out of the lumbar spine. And when that nerve is compressed, usually what happens, people will have pain that radiates down the back of the leg. So what was going on was the tumor was actually compressing the nerve, and that gave her pain radiating down the back of her leg, numbness of her toes. She lost one of her reflexes in her ankle, and she had some weakness in her foot. She had a hard time standing on her toes. So anyways, to make a long story short, once we found the mass, we set her up with a surgeon who had to go in there and do a biopsy of it. And it came back as osteosarcoma. So in our local area, we didn't have anybody that could excise it effectively, so we ended up sending her to Brigham Women's in Massachusetts. She saw a surgeon there who did what we call debulk the mass. So basically he cut out as much of the mass as he could, trying to spare all the nerve tissue and important things that she needs, to live a normal life. And then after they debulked the mass, then they treated with radiation and chemotherapy. So anyways, she had the radiation therapy and the surgery, and she did well after that. So does that answer your question?
Yes. Is a bone cancer diagnosis something you should fear?
Like I said before, it's not very common. It's certainly not common in younger folks. Generally, we would see it in your older patients. Different types of cancers like colon cancers, breast cancers, prostate cancers can metastasize to the bones, and then and sometimes you can have some cancers that will originate in the bones, but bone cancer, it's fairly uncommon. Once again, thankfully we don't see it too much. So.
What was life like for the patients after they had the diagnosis?
Well, she was really stressed out. In medicine, we don't like to give a diagnosis unless we really know what the outcome is. we called her, or I called her into the office, and she came in with her husband, and I sat them both down, and I talked about the cancer or the potential for it to be cancer, but until we actually have a biopsy, we can't call anything cancer. So I sat her down and I told her that the radiologist felt like it was an osteosarcoma, and it was the most likely diagnosis, but once again, we don't know 100% until they actually take a piece of it. So at that point, like I said, we set her up with a surgeon, and they did a biopsy, and that's when they found out that that's what it was. And then at that point, then they determine what the best treatment is for the patient. And, whether some cancers you can surgically excise them, some you can't, depending on where it is. If you have a cancer around critical areas of your body, like around your aorta, you can't just get in there and cut it out, because you could actually end up rupturing a person's aorta, or important blood vessels in the body. You got to be careful. Sometimes, in other words, sometimes we just need to do radiation or chemotherapy when we can't use surgery to cure cancer.
All right. Thank you for your time.
Sure.